Hi everyone, welcome. Thanks so much for coming along to today's webinar on the Future Health Research and Innovation Fund's Spotlight on Rheumatic Heart Disease. We might just leave it another minute or two. We've got a few more people joining us, so before we get started, I'll just wait for that number to tick up a little bit further, if that's okay. So for those of you who are online, just before we formally get started, please use the chat or the Q&A button if you have any questions. You won't be able to speak to us during the recording, but you can absolutely pop your questions into the chat or the Q&A. So if you're having trouble hearing or you can't see, or if there's an issue with the presentation, please just pop your details in the chat and the team will be able to sort those out for you via the chat. So I will start the presentation now, if that's okay. And thank you everyone for making the time to come along today. Before we go any further, I would like to acknowledge the traditional custodians of the Whadjuk people of the Noongar Nation whose lands we are on today, and pay my respect to their elders past, present and emerging. It's an absolute privilege to be tuning in from Whadjuk country today, and I extend my acknowledgement to the traditional owners whose lands that you may be gathering on today, as well as any Aboriginal people who are joining us online. So today's Q&A is designed to provide you with a little bit more information and some more details around the Spotlight program. I hope to be able to share with you this exciting new program, to be able to put a little bit more context around the guidelines and conditions and the information that is available online, so that you can put forward your very best application. So today is we have asked before registering if you had any questions to pop those through to us. Thank you very much for those of you who did. We've attempted to make sure we address all of your questions that we have already received in today's presentation. But if you do still have a question, please use the Q&A function that you can see on your taskbar in the Teams meeting, and the team will be collating information for me for the end of the presentation so that I can address any questions we haven't already covered. We will be recording today's session, as you can see, and this presentation will be available on the FHRI Fund website later today or early tomorrow, so that you don't have to madly scribble down notes. You'll have access to this whole recording and the slides at the end of the event. If you do have questions, as I said, as we go, please pop them into the chat. But if you do have a question that follows this presentation, you know how to contact us at OMRI. All of our details are on the FHRI Fund webpage, and you can contact us via email at the doh.omri email address. So we'll make our very best attempts to answer all of the questions in the allocated time that we have today. We will also prepare an FAQ document and share that at the end of this presentation as well, so that we can actually answer all of the questions in writing to make sure that everyone has the same information. I'm sure the FHRI Fund needs no introduction to most of you, but the FHRI Fund is the state's $1.8 billion sovereign wealth fund. It is governed by a piece of legislation which securely allows for the FHRI Fund and the interest of that to come to the Department of Health every year to provide funding for research, innovation and commercialisation for health and medical research. We have around 292 million allocated over the next 4 years. And so far, since our inception in 2020, we have awarded $282 million to over 810 recipients. We now have 2 funding cycles for the FHRI Fund underneath our new FHRI Fund strategy, and the strategy is arranged according to 3 strategic themes. As you know, we launched our new FHRI Fund strategy in July this year, and a little snippet of our strategy on a page is available for you on the slides here on the screen now. You'll know that our new FHRI Fund strategy is bold. We have a vision that by 2035 we will triple the impact of health research and innovation with a uniquely Western Australian focus. This new strategy is designed to guide long-term investment, and it's a roadmap really to help us build and support a sustainable health and medical research and innovation sector. Our new strategy has 3 key themes of connect and collaborate, accelerate and translate, and foundational confidence. And the Spotlight program is our flagship program, which will bring to life the Connect and Collaborate theme of our new strategy. As you can see here, Connect and Collaborate has three important priorities. That they are to empower pathways and collaboration, to inspire impact through an aligned focus, and to be bold and predictable. And that's exactly what the Spotlight program is aiming to do. So at a glance, what is the Spotlight program? It is a program where we have allocated up to $25 million, which will be available over 5 years. It is the flagship program of our new FHRI fund strategy from 2025 to 2030, where we are seeking to invest in a major, uniquely Western Australian issue each year. This year's Spotlight is rheumatic heart disease. Next year, we will announce a new Spotlight. And the process in terms of seeking sector feedback and input into how we decide what our future Spotlights will be coming out and shared widely with the sector early next year. The Spotlight program also aims to drive transformational change and to have measurable improvements in health outcomes. So as you will have seen, I'm sure each of you have downloaded the guidelines and conditions for the Spotlight program off our FHRI Fund website. And if you haven't, please make sure that you do, because these guidelines and conditions do guide the application process. The Spotlight program aims to do two things. It aims to support research and innovation activities that improve the health and wellbeing of Western Australians and position WA as a leader in the field. It also aims to bring together the community, researchers and innovators and all other relevant stakeholders to collectively address the Spotlight focus area across the healthcare continuum of prevention, diagnosis and treatment to drive change. Put very simply, the Spotlight will work in three distinct stages. First of all, we are seeking the Spotlight lead. We're looking for the applicant, the organisation and the lead to lead this Spotlight for the next 5 years. Once we choose the Spotlight lead, the lead will then be given 9 months to consult widely with the sector to develop an action plan. And then once approved, the Spotlight lead will then have 4 years to implement this action plan along with their partners. So this very first stage of the Spotlight is all about choosing the person who's going to lead the Spotlight. It's not about understanding how the money will be spent over the next 5 years. It's about awarding the lead, who will then spend 9 months with $1 million to speak with the entire sector to develop the most appropriate action plan for the following 4 years. So in a little bit more detail, the Spotlight program has been pulled apart into two parts, Part A and Part B. Part A is the application, which is currently open. Part A is all about developing an action plan. So what we are seeking to do is to award a Spotlight lead through a responsible entity and provide that Spotlight lead with $1 million over 9 months. The activity lead and the team that sit around them will then have to develop a comprehensive sector-driven action plan. Over those 9 months, you will be expected to form partnerships, you'll be expected to consult with community and consumers, and you'll be expected to consider multiple research and innovation work streams. At the end of those 9 months, we expect to receive a detailed action plan, which will be assessed here within the Department of Health with an expert panel. And only at that time, on receipt of a satisfactory action plan, will Part B be implemented, which will provide funding for up to $24 million over a period of 48 months. So the main application process is now. Once we choose the Spotlight lead to start working on Part A, they will be delivering Part B. So this is the one call for the Spotlight lead is happening right now. So what does Part A look like and what happens in Part A? Once we identify the Spotlight lead, we will be asking the Spotlight lead to consult widely and make sure all stakeholders have a voice. So you don't need to, in this application process right now, know exactly who you're going to consult with and know exactly how you're going to spend the money over the next 5 years. What you need to tell us now is that you are the right lead to be able to bring everyone together over the next 9 months to develop a sector-wide action plan. So in these 9 months, we expect the Spotlight lead to consult widely, to listen to everybody, to hear all the stakeholders, to talk to all of the players in this space, to truly understand what is happening within RHD. We expect you to also review and consider best practice from around the world, but also what's happening right here in Western Australia, in our backyard. We then expect you to plan and consider all the aspects of RHD and what we need to do to effect real change. Then we expect a draft 4-year plan, which includes research, innovation, and translation activities, which focus on prevention, diagnosis, treatment, but most importantly, how we can actually implement those things into the way in which we deliver healthcare to Western Australia's population. What we absolutely want to see at the end of this Spotlight is an absolute change in the way in which we deliver care for RHD, and hopefully looking toward eliminating RHD in Western Australia. So after you have developed a draft plan, you'll be expected to then consider all of the partners that you may need to work with to deliver the research, innovation, and translation activities. It is not expected that the Spotlight lead and their team and their organisation deliver all of the $25 million worth of activities in the next 4 years. It's absolutely considered that the Spotlight lead will find all the right partners, and those partners will deliver the research, innovation, and translation activities. Once you have a plan, you've identified your partners, you need to make sure you seek sector-wide review of the plan, and it's that plan that then gets presented to the Department of Health at the end of the 9 months before we then release the 4 years subsequent funding of $24 million. So as you can see, Part A is all about consulting. You, at this point in time when you apply, you don't need to know what the plan is, but if you are the successful Spotlight lead, you then need to spend those 9 months consulting widely, so we have a holistic plan for how we are going to implement the Spotlight. The outcome of Part A is that you will have delivered an approved 4-year plan to deliver transformative and sustainable solutions to eliminating RHD through a combination of research, innovation, and translation activities. Partnerships are key to the Spotlight program, but we don't expect you will know all of the different players with whom you will need to partner at this point in time, which is why Part A is so important. Part A is about providing you with the time to find all the people that are already doing great things or that can help you bring the Spotlight to life. So we do expect you'll have some partnerships in place as you commence your application at Part A. But following the consultation, we expect that new and clearly defined partnerships will have emerged and will be in place in your action plan. These partnerships should then form part of the action plan that's presented to us in Part B, and then these partners can either be supporting partners and people who are providing advice and support along the way, or they could be partners with whom you will be providing funding to allow them to be implementing their stream of research, innovation, or translation activities. So for now, in this application stage, we don't expect you to know have all of the partnerships in place. We do expect you to have an idea of who you will be initially consulting with, but we certainly don't expect the full list of partners that you would have in place by the end of the 9 months. So the Part A application that we're asking from you now, what we're looking for is a Spotlight coordinating team and a lead who'll be able to suitably lead this piece of work for the next 5 years. We want to see your plan for consultation and collaboration. We want to see your plan for developing a comprehensive sector-driven action plan to address all aspects of RHD. We also want to see your plan for forming and managing partners and your plan for streams of research and innovation. We'd also like to see consideration of, although we don't expect we'll have bedded down considerations of cash and in-kind contributions, but we want to see an outline of how you will be thinking about co-investment with the Spotlight program. And this application is due on the 11th of March, 2026. So you don't need an action plan now. You don't need to know who all your partners are going to be, but you do need to be able to tell us how you will spend the next 9 months making sure everyone has the opportunity to be part of the planning for the future 4 years of the Spotlight program. The successful applicant of the Part A application will receive $1 million for 9 months. This is when you'll start to form your partnerships, develop that action plan, and that action plan then sets out the research and innovation activities that will be delivered through the Spotlight partners into the future. That will also need to give us a plan for how you will be distributing funds to all of the different partners as well. Anyone can apply to be the Spotlight lead and the Spotlight coordinating team. It does not have to be a medical research institute. It does not have to be a university. But the applicant has to have and the lead has to have the experience and the understanding of RHD and the ability to bring everybody around the table to be able to coordinate activities over the next 5 years. Your organisation also needs to be able to receive the funding from us and then disperse that funding out to the right partners who are implementing the Spotlight activities. I will also note that what the FHRI Fund Advisory Council are looking for is not to fund more research and innovation that just stays as research and innovation. It's looking to fund research and innovation that absolutely impacts the way in which we care for people. So we're looking very much for translation activities, and therefore the application of the Spotlight lead and the coordinating team should have an absolute focus on and an ability to translate. For your budget requests for Part A, this is really around everything you need to do for the next 9 months. So the budget in this current application is not the entire budget for $25 million. It's the budget for the $1 million and 9 months to consult and develop an action plan. You may have partners involved at this stage, and therefore those partners may require funding to be able to work with you to develop your action plan. You should absolutely be considering consumers and community involvement requirements and payments. You can absolutely seek salary support for the Spotlight lead as well as the coordinating team, as long as the lead and the team only have funding of are not employed for more than 1 FTE across multiple roles that you might have. You may claim for essential services and supplies, travel that is essential to the activity. So we would see and we would absolutely see justification in travelling to regional Western Australia as part of this first 9-month consultation process. You can claim funding for equipment that is unique to the activity, including specialised computing requirements if they are required. The Part A budget requirements are as per the guidelines and conditions. Many of you will know and will have heard that we are commencing a review of our guidelines and conditions and the eligible costs. That review is happening in early 2026. So these Gs and Cs and the salary on costs and overheads, etc., are as per the Gs and Cs published for this for Part A. If, as a result of our consultation, we over the course of the next 6 months, change those guidelines and conditions, they will be in place for Part B. But for Part A, the guidelines and conditions and the expenditure requirements are set out in the guidelines and conditions. And just a reminder that this budget is for Part A only. So the Spotlight coordinating team, we are looking for an FTE commitment that should be adequate to coordinate the activities for Part A. So that is for you to determine within the $1 million budget, the team that you need and the FTE that they're required to undertake these activities. Team members are those who are involved in implementing the Part A activities. They don't need to be the partners that you might partner with in Part B, because you don't actually know who those partners are going to be. So the Part A budget and the coordinating team should be the team who are going to conduct the consultation over the next 9 months. It can include project managers and operational staff. It's not expected to be all researchers and innovators. And the number of Spotlight coordinating team members is really up to you, and it needs to be determined by the mix of skills, relevance, experience, track record, etc., to make sure that you can absolutely collectively lead and manage this large-scale initiative and consult widely. So we have no expectations as to who should be on the team or how many people should be on the team, but salaries of those team members is absolutely justifiable in this stage of the Part A of the Spotlight. Part B, and Part B is only going to be offered to the Spotlight coordinating team who are successful in Part A. It is a direct grant that will then be provided to that same Spotlight lead and Spotlight coordinating team. So for Part B, you will need to have submitted your action plan that you've developed over these first 9 months, noting that there could be iterative review of the action plan once it's submitted to the FHRI fund and the department. Once we've agreed on that 9-month action on the action plan that you have developed, we will then enter into a new contract with you to cover the 4 years of the implementation of the Spotlight. And there is funding of $20 million plus an additional $4 million if required that's available for those 4 years. That will all be built into the process. Once you've submitted your Part A action plan, we will then work closely with you to develop, to review and develop the budget and sign that off within our grant funding agreement. The Spotlight coordinating team will then need to lead the implementation with the partners of the Spotlight program over the next 4 years. At the point of award, as I said, that's when you'll need to submit your budget for Part B, not now. In Part B, the Spotlight coordinating team will be responsible for establishing strong program governance that guides the following 4 years of activity. That Spotlight coordinating team and the lead will need to oversee and manage the entire program over the 4 years to ensure you deliver on the agreed action plan. You will be required to distribute funding to partners who are delivering different components of activities of the Spotlight program, and we're absolutely looking for you to attract co-investment from other sources as you progress your activity. We also think this is a wonderful opportunity for you to be applying for other funding sources to further promising areas of work as your work progresses. The Spotlight coordinating team need to coordinate whole of sector activities to share the learnings and to share updates of what you're doing across the 4 years of the Spotlight program. And of course, there'll be annual reporting to the FHRI Fund Advisory Council. All of the requirements of Part B will be discussed in detail with the Spotlight coordinating team and activity lead once you submit your application. But effectively, once you submit your action plan at the end of Part A. But effectively, what we'll be looking for is to develop Part B, which is signing off the action plan, making sure the budget is commensurate, and making sure the Spotlight coordinating team have all of the right partnerships in place to be able to get the money out to the different partners who will be delivering different streams of the Spotlight program. So the applications are open. The closing date for the Spotlight is the 11th of March 2026. There is now an online application form available in our grant management system, so please make sure you start that application form as soon as possible. We will be conducting the review and interviews over the end of March and April. The review process will depend on how many applications we receive. We do expect conducting interviews with the appropriate Spotlight lead and coordinating team. We aim to be awarding and executing a grant funding agreement in May, so late April through May, and then we will have a grant commencement date of June, July, as soon as the grant funding agreement is executed. You will then have 9 months from June or July in 2026 to complete your action plan, to consult, to execute the Part A, to making sure you're consulting widely and developing that action plan. That action plan will be due in March 2027. We'll make sure we review that action plan, negotiate any changes that are required, negotiate the budget with you, and then execute a new grant funding agreement for $24 million for you to then begin commencement in June 2027. We are aiming to announce the Spotlight lead at the next open day for the FHRI Fund, which we are predicting will be in May 2026. But we will, of course, these timelines are subject to variation should anything major happen in and around the sector in the meantime. But this is our plan for now. So before we finish, I just wanted to remind everyone that there was a fantastic announcement a number of weeks ago now. So the second World Heart Federation World Congress on RHD is coming to Perth in November 2026. Perth will be alongside WA Government, alongside Heart Foundation and a few other sponsors are so pleased and proud to be bringing this event to Perth. The Spotlight lead, who will be announced in May 2026, is expected to have a great presence at this World Congress on Rheumatic Heart Disease, and we think this is a wonderful opportunity for the Spotlight lead to be working really closely with experts from around the world in developing and testing their action plan. So we couldn't be more pleased that this World Congress is coming to Perth right at the time when our sector will be deep in developing an action plan for the next 4 years. So they were that's all of the information we had to share with you today. I do hope that the guidelines and conditions are self-explanatory and that we have answered most of the questions that we had in today's Q&A. I can't see that there are any questions in the Q&A, but I will give you a moment to add some questions just in case I haven't answered them, noting that you obviously can't, speaking is disabled in this town hall format, but you're very welcome to pop your questions in the Q&A. We will share all of these slides. We will have the recording available on the website, and we will be putting together an FAQ page, which will be based on the questions we have already received that hopefully we have addressed today, but we'll absolutely address them in more details in an FAQ page. You're also very welcome to contact us. Most of you know me and you're welcome to contact me directly. Otherwise, you can contact our generic email address at the doh.omri@health.wa.gov.au. So without any questions popping up, I will just give you one moment. Perhaps if you do want to ask a question, just quickly type in to say you've got a question coming. If not, I want to thank you very much for coming along today. I hope that has clarified a little bit of information around the Spotlight program. So if I can succinctly summarise, this process is about looking for a Spotlight lead and a coordinating team who'll be asked to demonstrate how you can absolutely lead this Spotlight initiative for the next 5 years. You do not need to have a full plan of what the 5 years is going to look like. You just need to be able to demonstrate to us that you are the right lead for the future of this Spotlight program. You'll be then given $1 million. You'll then have 9 months to be able to consult widely with the sector and come back to us with a detailed action plan for how you will commit the 25 or 24 million over the following 4 years. Again, our expectation is that we'll be funding research, innovation and translation activities across spanning prevention, diagnosis, treatment and models of care. We're very much looking to eliminate RHD. We are looking for not just new research and innovation questions, but new research and innovation questions that get translated into practice and have a meaningful and lasting impact on RHD in the Western Australian community. So with no further questions, I'd like to thank you very much for coming along today. I really hope today was helpful. If not, you absolutely know how to find us. You can contact me, stacey.waters@health.wa.gov.au, or our doh.omri address, but all of that is available on our website and will come out to you today via email with the slides, and then our website will be updated in due course. So thank you, everyone. I'm really looking forward to seeing the applications and encourage as many applications as possible for this, our inaugural FHRI Fund Spotlight program. Thank you very much.